Final report.
This government not only didn't react on time, but way behind, and days meant lives. And yet they were reacting weeks after.
The report blames governments for the thousands of deaths of residents in long-term care. Plus,
unfortunately, they're just saying, oh, it's going to be this date. And this date comes and there's no vaccine.
With the number of outbreaks in homeless shelters climbing, we'll take a look at the challenges and the plans to get vaccines to some of the most vulnerable. And
we can't do anything about his death. That's what it is. But if we can bring anything that brings his name and bring a positive aspect to things, it's a feel-good thing that we can do this.
A message in a bottle was how a family decided to honor their loved one. Years later, the positive note inside has brought two families together.
This is CBC Saturday News.
Good evening, I'm Marivelle Tarouk. Ontario's long-term care sector needs sweeping reforms to protect its vulnerable residents. That's the finding of a report completed by an independent commission and delivered to the provincial government last night. The report blames governments, past and present, for the thousands of COVID-19 deaths in the homes. Lorenda Redekop has the details and the reaction.
I'm having to read it in blocks because it's so emotional.
The report is personal for Kathy Parks. Her dad lived at Orchard Villa long-term care home, one of 78 residents there who lost their lives in Wave 1.
This government not only didn't react on time, but way behind, and days meant lives. And yet they were reacting weeks after.
One of those delays, a requirement on masks in long-term care homes. The chief medical officer only mandated them 2 weeks after that happened in hospitals. The commission details the experience of staff, crying before, during, and after work, vomiting in locker rooms from stress, and watching residents whom they loved die in great numbers. One of the 85 recommendations is that counseling be made available for staff and residents paid for by the homes. Staffing is the biggest ongoing concern in long-term care homes, according to geriatrician Dr. Samir Sinha.
Unless you have enough staff who are well-trained and well-paid and want to be there and can remain there, then it means that poor work conditions mean poor care.
He hopes the government will do more.
This government is saying it's taken action, it's doing everything it can, it's sparing no dime, but really most of the measures the government has taken are not the full measures that this report's calling for.
The report suggests a new model for building homes, similar to privately funded hospitals, with the care handled by a mission-driven organization, whether it's for-profit or not.
Care is care, and it's most important that as we go forward, those devoted to care are devoted solely and principally to the betterment of the residents.
He says this about the 85 recommendations.
This is not set up for future discussion. This industry has been reviewing itself for decades. It's time for action.
The long-term care minister says they're working on staffing, adding inspectors, and reviewing inspections. The report recommends bringing back unannounced annual checks on homes.
The commissioners say the province needs to accept that there will be another pandemic and that Ontario must learn the lessons from COVID-19. Lorenda Redekop, CBC News, Toronto.
Today, Ontario is reporting 3,369 new COVID cases and 29 more deaths. However, while the number of cases has stayed under 4,000 for the last few days, ICU admissions climbed to 900 for the first time. Today, the Ontario Health Ministry said that it hasn't yet activated an ICU triage protocol. Activating it would mean healthcare providers would have to make hard decisions, including who gets potentially life-saving care and who doesn't. This is what the president and CEO of the Ontario Hospital Association said about the possibility of this scenario.
It would be a failure of all of us in healthcare if, despite this third wave, a hospital somewhere in Ontario has to use the triage tool. We're working as hard as humanly possible, our clinicians and the staff in hospitals, to make sure that it never comes into effect. But I can't say with complete confidence that it will never happen. I'm just saying we are fighting every day to to prevent it from occurring.
A large shipment of the Johnson & Johnson vaccine has arrived on Canadian soil, but their distribution is on hold due to possible safety issues. The province still hasn't decided who will get the vaccines once they are approved, but those who work with people living in the city's shelters and encampments are lobbying for first dibs. Linda Ward has been speaking with them.
All people experiencing homelessness have been getting the vaccine, but you haven't got it.
No, miss. Not one.
Stephen Green's been lost in the shuffle. He moves from shelter to shelter and hasn't yet received even one dose of COVID vaccine.
It's unsafe, and they say in the system that they're supposed to serve and protect from our taxes. We should be able to get vaccine, but unfortunately, they're just saying, "Oh, it's going to be this date," and this date comes and there's no vaccine.
It can be challenging to reach people like Green, and tracking them down for a second shot can be nearly impossible. That's why Dr. Andrew Bond's lobbying to have the one-shot Johnson & Johnson vaccine approved for use in shelters and encampments.
We know that every time we give an AstraZeneca vaccine right now, we're creating still a complicated problem a couple months down the road for ourselves. We can get this done within a couple of months right now at most, if we actually have Janssen vaccine. If we don't, we know that we're going to end up having to still do this into the fall, most likely as well.
Right now, plans to distribute the Johnson & Johnson vaccine next week are on hold. Health Canada learned they were partly manufactured at a Maryland facility with health and safety violations. They're working to ensure the shots meet safety standards. So 300,000 doses of the Johnson & Johnson vaccine sit in storage awaiting Health Canada's go-ahead, about a third of those destined for Ontario. But a spokesperson for Ontario's Ministry of Health says it's still too early to say exactly how those will be distributed, that guidance will come from the National Advisory Council on Immunization. But those who work with people experiencing homelessness say that guidance can't come soon enough.
You know, we are looking forward to the possibility of Johnson & Johnson, the one-shot vaccine, being used in this population, because I think it will make it easier. So it's too slow, and I think that's why we're still seeing, between 280, 300 cases in active outbreak, as of today, for example.
And if this doesn't come through, they worry they'll never reach all members of this changing population.
We're still going to have large numbers of unprotected people. So this is something that we actually can't wait for. The only option is get this done, or we're going to see more of the same.
For Green, this one-shot wonder could change everything.
That would mean my life is safe from catching the COVID. Yeah, it would mean a lot.
Linda Ward, CBC News, Toronto.
May 1st marks May Day, also known as Workers' Day. It is the second May Day during the COVID-19 pandemic, and organizations around Toronto use this milestone to continue to advocate for paid sick days for workers.
Their lives on the line because this government chooses to ignore them, to ignore our calls for permanent and adequate paid sick days. Today, on May Day, we stand with justice for workers.
At this event, organized by Decent Work and Health Network, organizers covered 16 Conservative MPP offices with posters drawing attention to the lives lost during this pandemic. An online event took place as well today, organized by Justice for Workers and Workers Action Centre.
This government has run out of excuses. It's time they paid the price. Their time is up, and our time is here right now for our movement.
Some of their demands include a $20 minimum wage and 14 paid sick days. The organizers say hundreds of people attended the online event.
Peel Region is suffering greatly. Peel Region is actually on fire with COVID-19 and has been through all parts of the pandemic, and it's gotten even worse in the third wave.
A group of education workers, medical experts, parents, and local activists spoke about how the third wave has affected Peel Region. They want more to be done to help the COVID-19 hotspot. Among the group's demands, paid sick days, priority vaccination, and more protections for workers. Peel Public Health has partially closed a third Amazon distribution center to control an outbreak of COVID-19. The partial and temporary closure affects the Amazon facility at 7995 Winston Churchill Boulevard in Brampton. In a statement, a spokesperson told CBC News some of the safety measures they've taken include, quote, investing tens of millions of dollars in health and safety measures at our Heritage Road and Bolton facilities, regularly testing all employees multiple times, and providing full pay and benefits to those self-isolating. Today, community care nurses in Sarnia are walking off the job. They say they'll continue to strike until their employer returns to the negotiating table.
What they're offering us devalues us. I mean, we're highly trained nurses that are going into patients' homes, into their schools. You know, we have to be cross-trained in a little bit of everything. Community care is so different than any other type of nursing organization because everywhere else you have coworkers that are standing there, you know, arm in arm, able to help you.
They're asking their employer, the Victorian Order of Nurses Canada, for a raise of 1% and paid sick leave for all employees. Their union says 23 registered practical nurses began striking today, but because of COVID precautions, only 3 nurses are on the picket line at a time. In a statement to CBC News, VON said, "We are working closely with our community partners on contingency plans to limit any potential impact on our clients and their families." And VON is fully committed to the bargaining process and to continuing to work toward a resolution. It's been a windy weekend in Toronto, and that is some debris that fell from a tree in a neighborhood close to the Danforth during yesterday's wind gusts. So far, there have been no reports of injuries. Sophia's here with our first check of the weather. Yeah, you could really hear the wind, if you were outside, Sophia, really feel it in Toronto today.
April came to a blustery end today and yesterday. Now, winds have eased a little bit, and May will be slightly calmer to the start, but not necessarily less unsettled. We actually had a 93-kilometer-an-hour gust recorded in Oshawa yesterday, so really gusty. Continued to be that way for the last 24 hours or so. Some 70, some 80-kilometer-an-hour wind gusts. Winds are coming from the south. They are still very breezy, though. Around the Golden Horseshoe and the GTA, the winds have changed. They are warming things up a little bit, but also bringing in some unsettled weather. We are seeing the cold front come through right now, so temperatures have dropped a little bit. You're looking at low double digits for many of you. Rain's coming in for those of you in the city of Toronto. You've had a few rounds around the Golden Horseshoe and the city of Hamilton. It will bring in this boundary that will sit with us for much of the next week. Throughout the day Sunday, you're pretty much guaranteed showers. If you're between Toronto and Peterborough, everybody else could see isolated showers, and with a lot of convective energy in the atmosphere, maybe even a rumble of thunder into the overnight and into throughout the day tomorrow. But it'll be a really nice warm up for those of you in parts of southwestern Ontario. We're talking high 20s in Windsor, just teens though in the city of Toronto and to the north. Seasonal though, and just above. A cool down expected though for the long range.
Okay, well, we'll check back in a few minutes with you then. Toronto's active TO program returned this weekend, giving people a chance to head outdoors, get some exercise, and enjoy the spring weather. The program was created last year to promote COVID-safe outdoor activity, and it has been brought back amid a third wave. Dahlia Ashry caught up with those taking part to see if it's safe enough.
Toronto's active TO program is back this weekend, so you might end up stuck in some traffic.
It's not worth it. We've been here for like an hour. Yeah.
Or you might just be like 6-year-old Finley.
I want to stay inside.
But with the current stay-at-home orders, today was a chance for many people to head outdoors.
Good weather. What can you ask for more?
City Councillor for the Scarborough Rouge Park area, Jennifer McKelvey, says last year's active TO was a hit.
29% of people that went out there said they were new to cycling or had just started cycling again. So really, it was hugely successful. So glad it's back this year.
And while many people were following COVID protocols and wearing masks, some people we spoke to admit they met up with friends outside their household.
Well, we'll be keeping distance.
Others who took part said they're not concerned because they're outdoors.
I think
for the risk benefit for these kids, like who have been cooped up all day and all week doing virtual learning. This is a highlight for them on the weekend.
Still, McKelvey is reminding people to have fun, but also stay safe.
Well, the stay-at-home order still is there, which means that we are only supposed to be socializing with people in our own household. So hopefully everybody will respect the rules so that we can continue to have this great opportunity next weekend.
Unlike last year, this weekend there won't be lane closures along Lakeshore West because of road construction. But if active TO does resume on Lakeshore West in the future, Councillor McKelvey says it will be on select weekends. And this summer, some new routes may be added as well.
Well, starting on June 6th, they're looking to open up Allen Road for active TO. There is still investigations underway to look at Exhibition Place, some limited closures of Lakeshore West. Out here in Scarborough, we're looking at the Meadoway.
Road closures along Bayview and Lakeshore will be in effect until Sunday night. Dahlia Ashry, CBC News, Toronto.
Well, in a mood for foraged wild leeks or fresh fiddleheads? Folks in downtown Toronto are in luck. The St. Lawrence Market finally opened their seasonal outdoor stalls today.
Coming to a market and getting your groceries in a different setting that's more social, that's in open air, I think that it makes, it's a happy place to be. It's a nice experience, and we need those right now.
Beautiful day to celebrate the spring vegetables that are coming. Every season between May and November, the market brings extra farmers with fresh produce, mostly from southern Ontario, including Hamilton and Niagara Falls. With COVID-19 restrictions inside and outside the market, here's what one farmer had to say about the changes.
Our customers are just like family, so they respect us, we respect them, and it's just a win-win situation. Everyone is so careful, everyone is so considerate, and I'm that way to them too.
Yeah. The market is running at 10% capacity, but don't be fooled by the physically distanced long lines. Average wait times are under 10 minutes, up to 15 during peak hours. We'll have more ahead. Stay with us. New COVID-19 cases in India today passed a staggering mark, 400,000, a daily figure no other country has hit. Hospitals are struggling with oxygen supplies. At one, a delivery today came too late. Several patients died when staff had no oxygen to administer for about 80 minutes. India today opened vaccination to all adults, but there are vaccine shortages. India's recorded almost 212,000 deaths. It is widely believed the actual number is much higher. And in this province, the Indo-Canadian community is busy working to bring some pandemic relief to their home country. Sewa Canada is a charity group working to coordinate help on the ground. And this is how they're helping.
We have partners on the ground, Seva International India, with a whole network of organizations in 20 plus states which are active on the ground as we speak. We've been assigned the state of Gujarat and the city of Bengaluru that we can work with our resources that we have. What we are setting up, our volunteers have set up 4 COVID care centers, isolation centers with sources of oxygen in Gujarat. We want to save lives in wave 3 and wave 4 by investing smartly in oxygen plants in hospitals that can serve the future needs, take care of needs now, and then future needs too. So both immediate relief and long-term relief is our focus.
I found a message in a bottle. I found a message in a bottle.
Not realizing what this, how powerful this was going to become.
Surprises come in all shapes and sizes. How this one unfolded to tell the story of one family to another. That's coming up. A message in a bottle has been recovered years after it was cast into Lake Huron, and it brought two families together. CBC Hamilton's Dan Takema has the story.
Message in a bottle. I found a message in a bottle.
Not realizing what this, how powerful this was going to become.
Shandell Kerrigan knew she'd found something special.
You can see a picture on it there.
When she stumbled across a bottle on the beach on Manitoulin Island. Inside was a $10 bill and a poem starting with Dear Son.
I sit here and ponder how very much I'd like to talk with you today. There are so many things that we didn't get to see. I know how much you care for me and how much I care for you.
The bottle was thrown into Lake Huron more than 4 years ago. It's a memorial of sorts for Brandon Wally, a 23-year-old who died after being hit by a car in Flamborough in 2016. His family says the bottle was a final goodbye.
It had, his obituary, a poem, a picture, a $10 bill, and a message to, have a drink on us in his honor. So my daughter, Kaylee, Brandon's niece, threw the bottle out and we kind of watched it just sail off.
Brandon's family says he was walking and on his phone when he was hit. So the bottle is also a way to share their message of phones down, eyes up.
We can't do anything about his death. That's what it is. But if we can bring anything, it brings his name and bring a positive aspect to things. It's a feel-good thing that we can do this.
In the end, the bottle didn't go far. It turns out the two families are neighbors. Now the bottle has brought them together. They've since spoken on FaceTime, shared a drink and some tears, and have plans to throw the bottle back together.
It keeps our son's name alive, out there, and it's very emotional.
Kerrigan and her husband say they plan to add a page with their own names and a fresh $10 bill.
We'll see how long we can keep this going, right?
But we're going to take it out in a boat this time, so
Yeah.
it goes further.
Dan Takema, CBC News, Hamilton.
So, Sophia, if we can get through the blustery weekend, there's good news in store for us?
I wish I could answer that positively.
Okay.
It's the other side of the glass, the less empty one. You know what? It's funny, because in early April, we were talking about May-like warmth, even early June-like warmth. And now that we're in May, we're talking about early April-like weather and a cool down. It starts right now, really. The clouds have moved in for the most part of today, though. It was beautiful. Blue skies. We even warmed up with some sunshine. It's these cold fronts coming through, heavier rainfall locally, especially around the Golden Horseshoe and the city of Toronto, moving into the eastern edge of the GTA as well. I wouldn't rule out an isolated rumble of thunder into the overnight and into tomorrow as well. Locally, a heavier rainfall with some of that thunder as well, maybe even some small hail. And then as we head into Sunday, it's a different story. A warm front pushes in, so you'll pretty much be dry to the south of it and have a really, really nice warm up. So enjoy that while you can. To the north, you're seasonal or just above. So it's not a bad day when it comes to the temperatures. Cooler around the lake, but look at Windsor. That's 2 weekends in a row. You've had this really, really nice warm up. And then we're rainy Monday and Tuesday, and cool and unsettled will be our MO for the rest of the work week. Quite a big temperature drop into the rest of this work week as well, about 6 degrees below seasonal, and here is why. So the warm front tomorrow is at the northern edge of this bigger system that will be stateside. It will bring in widespread rain Monday, Tuesday, and maybe even lingering into Wednesday, along with a real cool down as we head into Mother's Day weekend. So an extra robe and an extra hot chocolate for Mom on Sunday.
Ooh, that sounds great. Good advice. Thanks, Sophia.
You're welcome.
And that's all for tonight. Have yourselves a great night, and if you head outside,
Who saw my
stay
Band-Aid
safe.
on air?
Take care.
I just realized.